Okay, JD here, co-founder of SummaUp. So we're going to talk about today uh, of how testosterone affects the voice. Okay, so really we get asked this question a lot. If I get on testosterone replacement therapy, if I enhance my testosterone, will I get a lower voice, right? So you really can't tell when someone's on testosterone replacement therapy. They just basically look and sound, if they're doing it the right way, like a regular healthy person, right? So they might be, leaner, younger looking than the majority of people, right? But you could also chalk it up to them having good genetics and having a, clean lifestyle. You can almost always tell when someone isn't on testosterone replacement therapy, right? So he or she may lack muscle tone, kind of a little, be carrying an extra body fat. The eyes kind of are a little aged, right? They walk differently. They're kind of not so confident in their gait and kind of how their presence is. And they're lacking this overall energy and presence, right? So older people that aren't receiving testosterone replacement therapy usually sound different. And here's where the kind of the voice goes. So we're talking older people by meaning 40 years young and up, right? So their voice is definitely weaker and maybe a little kind of discordant. So when they speak, it kind of sounds like the hinges of creaky coffin, one of those old, horror movies. It's just like the classic old person voice. This change in pitch and vocal quality is called prosophonia, and it has a lot to do with declining levels of testosterone for men. So I guess the $1 million question, okay, so why does, the adult version of Darth Vader, descend from the young Darth Vader, right? Anyways, but getting back to it, when a young person hits puberty, his body is kind of exposed to a flood of testosterone. So in addition to making him feel more muscular and build more muscle mass, it also affects his voice. So the vocal cords start to grow in length and thicken. And so where the cords were once thin and higher pitched, like the strings of a violin, testosterone kind of turns them into a kind of deeper, like resonant cello type, right? And so testosterone also increases the size of laryngeal cartilage, right? So muscles and ligaments that, and the overall effect is kind of there's going to be a drop, right, in the pitch of an octave. So the vocal cords of females too are affected by the hormonal surge of puberty, but their voices only drop, a third of an octave. So male and female voices remain largely unchanged through the rest of the youth and middle age, provided their vocal cords aren't kind of impacted by vaping or pollution or shouting or systematic disease, right, or smoking, right? So, once testosterone levels start to decline appreciably, though, the voice may sometimes, be changed dramatically. So laryngeal muscles start to kind of decrease in size, and the fibers, right, the collagenous fibers decrease in quantity, leading to kind of an overall stiffening of the vocal apparatus. So whereas the stiffening usually causes older women's voices to get deeper, so they go lower, men's voices often get higher, right, because of a change in pitch, which is really determined by how fast the vocal cords vibrate. And so this vibration is largely controlled by the thickness of the vocal cords and how well the muscles that surround them can tighten and relax. Okay. So testosterone, of course, plays a role in the strength and size of muscles, even laryngeal muscles, right? So it's only, logical that low testosterone can cause the voice to weaken, right? So the net effect is the old kind of male voice or kind of low testosterone male voice is less powerful, higher pitched, and characterized with tonal abnormalities, right? Which is kind of weird. While the older female voice is a little, which is also weak, is gruffer. It will also kind of suffer from the same tonal abnormalities, right? So think, if you're watching cartoons like The Simpsons and Homer Simpson's dad or Marge's, mom. So the fact is like really pronounced. So that versus anyone kind of who has normal hearing can kind of tell if there's an old person on the end of the phone. Like if you're talking to somebody on the phone or even if you're texting them, maybe you can see like the use of emojis or whatnot, but to tell you're dealing with another person, right? Or their kind of, the phrases they use or how, how much TikTok they watch. Okay. But getting back to it, like really, in SummaUp's experience or our clinical experience, men and women that kind of start hormone replacement therapy in middle age don't kind of have that decline in vocal strength or quality. They kind of continue to sound like more vibrant, younger, regardless of their chronological age. And so older people with kind of weak voices can gain some of their vocal pitch and timbre, right, and steadiness by starting testosterone replacement therapy, right? So it really isn't too late, to kind of get back and to feeling your best. And if sounding younger is like a priority for you, listen, you can talk to us, but unless you're involved in a startup, technology, leadership, sales, public relations, right, or any job or position that requires you verbally communicate with people. Maybe it's a little different in the age of work from home and the use of Zoom, right? Maybe it's not as big, but if you do, right, a young voice really kind of is characteristic of vitality and health, and that can be also attained through testosterone replacement therapy, right? So if you want to learn more about how we can help you in this regard or help you change how you age, go to startsoon.com. Just want to kind of share a screen with you to show you what it looks like. So you can go here. So really kind of this is, SummaUp. Go to startsoon.com. You can learn more about us. As I said earlier, we kind of are the only clinic that has over 50 plus video authentic testimonials. These are real guys. I encourage you to watch this to show you how we can help you, how we can help you change while you age, right? And so really just going through this, you'll understand these aren't, actors. These are basically real guys, different ages, different styles. And this can really help you understand the benefits of what we can help you with. Yeah, yes, we're real. Yes, we're the real deal. And yes, kind of we're the best at what we do. And you'll understand why we are. Okay. So if you want to learn more, visit startsoon.com. After you're done kind of watching these, looking at our site, okay, book a visit and we can kind of help you kind of start and onboard and take it from there, okay? And if you click on the visit, you wait for the calendar to load, kind of book a video visit. Zoom has to be enabled. But, thank you for your time today. It was great.